Good morning. It's Thursday, December 3rd. Welcome to The Doctor is In, Ask Dr. Arwady. I'm Sybil Madison, your Deputy Mayor for Education and Human Services. I'm here with Dr. Allison Arwady. She's your Commissioner for the Chicago Department of Public Health.
Good morning, and thank you for joining.
This is where you can get all of your answers, your questions answered, and get the latest on COVID-19 in Chicago. You can give us your questions in the chat box below. You can also send them through Facebook or Twitter using the hashtag AskDrArwady. As usual, before we get started, let's check that distance. It's looking good. And I'm just going to turn it over to you to give us the latest data update.
All right, sounds good. So as always, you go to chicago.gov/coronavirus to get the latest on all things for COVID here in Chicago. You'll see up at the top of the page, there's a lot of data tabs now, and actually a lot of tabs for other things. So if you want to learn about vaccine, there's a vaccine tab. If you want to learn about contact tracing, there's a contact tracing tab. Testing, there's a testing tab. Protect Chicago, there's a Protect Chicago tab. And then under data, the very first drop down is the data dashboard. But in addition to the data dashboard, that's where you can get information about hospital capacity, about doubling time for cases, about outbreaks, about all kinds of other things that we're reporting out on. So please explore. But let's go to the data dashboard. You can also get there directly by going to chi.gov/COVID-. And if we pull it up, we got it up? Okay. So on the landing page here, first, we're seeing some green, which means we're seeing some improvement in terms of numbers. And as you can see, the current positivity rate across the city is at 11.6%. And that is down from 12.2% a week ago and down from a peak of 16% in this second surge here. So we continue to see some improvement there. Of course, we want that to be below 5%. So we're not yet to where we want to be. But if you look at this graph here in purple, you can see that it is coming down nicely. Next, if we move down, is our number of cumulative tests. We're at almost 2 million tests now across Chicago. And our daily testing average, you can see that one's red because we're averaging a little bit under 14,000 tests per day. You see last week we were over 18,000. That drop is because of Thanksgiving. We include, this is a 7-day average. And in the 4 days, Thursday, Friday, Saturday, Sunday of that Thanksgiving weekend, we saw a big drop in terms of the number of people getting tested for COVID. So we anticipate that will come back up. If you look at the graph to the right, you see, the huge increase in testing that we had running, just 8,000 or so tests at the beginning of October, all the way up to running about 19,000. And then we've seen this steep drop off. We will expect that to likely come back up, over the next week or so.
Because there was one day without testing at all.
There was still
that holiday.
There's always
there was
some
testing on the holiday.
Yeah, because you can go to emergency department 24/7.
Yes,
Urgent cares will be open. But if you look at the specific data, on the daily by demographic, if you actually hover over the day of Thanksgiving, there were fewer than 300 people in Chicago diagnosed with COVID on that day because there was not a lot of testing done. So if we look at our daily case average, you see that it's at 1,324 per day. That's still much higher than we want it to be. We want this less than 400 a day, ideally less than 200, but some nice improvement. And if we go over and click to the daily by demographics here, what you see, look at this graph here, like some really nice, I'll blow it up, some really good decrease. We need to get all the way back down to where we were over the summer, but that has been a real sign that Chicago, you've been doing a good job by and large. Staying home, really not going out unless it's for work, school, or essential things, not having people over into your homes who don't already live there, avoiding travel, and just generally putting COVID really top of mind again. That partnered with some of the, unfortunately, the rollbacks that we've needed to do in terms of gathering spaces, et cetera, we've seen real progress here. The question is going to be, will any concern that may have happened around Thanksgiving impact this fall?
How long is it going to take us to know?
We'll know over the next sort of 7 to 10 days just for sure what that's going to look like. And people probably saw that yesterday, both the state of Illinois and the United States broke the record for the most number of COVID deaths in a single day since the beginning of the outbreak. And the US is breaking records every day for hospitalizations. So concern there for sure. Yeah. We had a little bit of data that suggested Chicagoans broadly did a little better than the rest of Illinois and the rest of the US in terms of gathering just with immediate family for Thanksgiving. So that's reassuring. We know not everybody took that guidance, but a lot of Chicagoans did, and I want to thank everybody who did do that. If you are somebody who traveled or who gathered for Thanksgiving, remember that really we consider that to have been a fairly high-risk exposure, just given how much COVID is in the country and even here in Chicago at the time. So a reminder that for now 10 days, and we'll probably talk about the CDC guidance here, yes. Minimum of really 10 days after that, and ideally up to 14 days, you should be being extra careful. Don't be in close contact with people who are over 60 or have underlying conditions, and just recognize that there has been some more exposure there. So we'll see sort of what this looks like. I expect we'll see at least some probably flattening here, but then hopefully we can continue to see some good downward trajectory. All right, I think maybe I'll just show one other thing here. If we break this down by age, and again, I encourage you to play with this. Interesting, see how all of our age groups here are really dropping, but in yellow here are our people between 40 and 49 in Chicago, and then in the light yellow, I'm gonna actually change the time frame on this so you can see a little bit more just what's happening over the last month or so. We're seeing people in their 40s and in their 50s now outpacing the people in their 20s and in their 30s. Their 20s are the red line, the light blue are people in their 30s. And we're seeing both higher case rates and actually higher positivity among people getting tested in those 40s and 50s group, which is concerning. We've seen that age really continue to rise, and that's a sign.
Is it connected? Because, there was a time when we were really concerned about the 20 to 29-year-olds.
Yeah.
And I'm just wondering, are these their parents?
I think they are their parents, probably. By and large, just it's this sense that where you see a surge in one part of the population, that can sort of move into other parts of the population. And my biggest concern here is, you see in gray and pink down here, these are our people over 70 and over 80. They continue to have the lowest rates, excluding the kids, who are the 0 to 17-year-olds and are always at the bottom down here. But you can see that the drop-off, although we've seen some drop-off, has not been as good in people in our 70s and 80s. And that's part of why we're still, we've got 1,100 people in Chicago hospitals today, not in the ICU, another almost 300 in the ICU. Deaths are still on the rise here. And some of that is because, unfortunately, we are still seeing a lot of older people getting COVID. And so to the point, if you're in one of those younger age groups, first, it is definitely possible, of course, for you to have a serious outcome from COVID. We've had more than 360 people die just in the last month, just among Chicago residents. And yes, there were deaths. We had at least one death, somebody between 18 and 29. We had, I think, 9 deaths, people in their 30s, and then it sort of goes up from there. But the highest risk, it really, each decile there, the risk gets worse for hospitalization and for death, especially if there are people with underlying conditions. So while we still have a lot of COVID here, and we're still estimating between 1 in 19 and 1 in 27 Chicagoans is infectious right now with COVID. Still not the time for gathering at all, still the time for being careful, and still the time for being especially careful with people in those underlying conditions.
Yeah. I wonder if we should just take a quick look at race ethnicity.
Sure. Yeah, so let's do that. So if we click on race ethnicity here, again, this is just, I'll blow it up. This is just over the last couple of months. And what we see here, so in blue are Latinx Chicagoans. In yellow are people who report other but non-Latinx race ethnicity. Red are white non-Latinx, purple, black non-Latinx, and then green are Asian non-Latinx. And for a long time here, really for months, we've seen cases very disproportionately among Latinx Chicagoans. What we've been pleased to see is, we peaked here sort of early November-ish, is that the biggest drop has actually been in this blue group, in Latinx. And in fact, they're now below the other non-Latinx in terms of rates for the first time. And that's good, because we want our sort of hardest hit groups to, of course, recover the most. We're still disproportionately, if you look here, seeing cases among Latinx, but the improvement has been best there. And so again, really thank you to everybody who, either is a member of that group, or is being especially careful with essential workers, or working with a lot of the extra outreach that we've been doing related to Protect Chicago, being especially careful. There's been some good data there too around some changes in, how much people are out and about. We look at some of that by neighborhood and race ethnicity, have seen some good improvements, and some of the biggest improvements improvements actually among some of the neighborhoods that are predominantly Latinx. We know there are a lot of essential workers, especially in those groups, but there's been good improvement. And I guess while we're looking at data a second, let's look at the weekly data too. We see here that if we look at just cases, you see this darkest blue for the most recent week remains northwest and southwest sides. And if we look at our percent positivity, that too, very, very focused northwest and southwest sides. And those still remain our most important areas. While the whole city is at 11.6%, you can see like down here, 60629 is at 20.9, 21%, improved, definitely. And we're seeing, again, some of the biggest improvements in the hardest hit areas, but they still are the hardest hit areas. And the whole city, to be clear, still very much under a surge of COVID. So even if you live in a neighborhood that's lighter here, there is no neighborhood at this point that is sort of in a worry-free area at all from COVID. So we need the whole city really continuing to do the right things that help protect us.
Our work is not
Our
done.
work is not done. All right.
Okay. But very encouraging.
Yeah,
and
some good progress. I just want us to
showing
not.
us as a city that we're
doing
kinda
this.
doing it
We're
again.
doing it. We're bending the curve.
Let's not need to do it again.
Let's not need to do it again. If we can get this down, we will be making decisions about reopening using that same dial. When we can get this back under control, we'll be looking to do that.
Okay. Shall we turn to questions?
We shall.
All right, Jackie Clark Edwards from Facebook. If you get a vaccine, do you have to quarantine from family members after the first or second shot?
Okay, good question. No. So when a vaccine is available, which will not be yet, the FDA has still not approved, but we are anticipating that they may grant the first emergency use authorization as soon as December 10th. And we may be distributing vaccine here really as soon as the following week or the week after. There is no possibility that you can get COVID from one of these vaccines. These first two vaccines that are approved do not have killed COVID virus in them. They do not have inactivated COVID virus. They don't even have a part of the virus in them.
Oh, that's very good for people to know. I don't know if people know that broadly.
Yeah. They actually, you weren't here when we went into a lot of the science of this earlier, but and maybe we'll talk a little bit about that. There's the way that these first two that are getting approved work. They're called mRNA viruses, and mRNA stands for messenger RNA, which is a genetic kind of recipe. It's an instructions for making a protein, and the protein that the mRNA carries the instructions for is basically the little spikes on the COVID virus, the crown, exactly. And so the idea is with this vaccine, you get an injection into the muscle cell, and then this mRNA goes into the cell and has the cell actually produce these little spike proteins, and then your body, your immune system, learns to recognize these spike proteins and give you immunity in case you encounter something like COVID-19 with one of these spike viruses after the case, after the vaccination. So
it's almost kind of putting in a copy or a dummy.
Yeah, it's a way of
tricking us.
It's tricking us. It's teaching your body to recognize the COVID virus and be able to fight it off without making you sick, without actually exposing you to the COVID virus. That's what's so important about vaccines. And so because there is zero chance, it is completely impossible for somebody to get COVID from these COVID vaccines, there is no need for you to quarantine or isolate or in any way change your behavior after you've been vaccinated related to spreading COVID. We will still be asking people to continue to mask and socially distance and sort of do all of that. But there is no risk of spreading COVID after getting COVID vaccine, just as there is no risk of spreading flu, and you can't get flu from a flu vaccine.
Got it. That is very important information
to
say over and over and over and over again.
If people have more questions about mRNA, I like to talk about the science.
Yes, I know. And I'm actually kind of, I want to talk about it more. This is very fascinating.
It is.
Okay, but we'll go on to the next question. From one of our regulars, Andrea Araujo Ayala from Facebook. Why did we receive a survey to choose between in-person and learning from home? It's due December 7th, when a teacher has mentioned that school will only start as in-person in 2021 with no option for learning at home.
You take that one.
I'll take that one. So yes, if you are a parent of a CPS student, you should have received a survey asking you about whether you're going to opt in to in-person learning. That survey is due on December 7th. If you haven't received it, please reach out to your principal. There's also a helpline that you can call. I think it's 773-553-KIDS. But it's going to ask you what your choice is, because every family has a choice. So it's your choice whether you're choosing the in-person option or whether you're choosing remote learning. So there is a choice, and we want to make sure that everybody has all the information that they want or need to make that choice for themselves and their family, but there is a choice.
Yeah, so to this question, it sounds like there's maybe just a little bit of confusion there. Families who elect to continue remote learning will be able to continue remote learning. But we are excited about starting to bring back some in-person education. And this is going to start assuming that we continue to see our outbreak broadly under good control and that doubling time coming down, which is looking very good, starting with the pre-K and the special ed kids, and then looking ahead just a few weeks to really bringing back some of the other elementary kids. This is very much in line with what the science suggests is the right thing to do in the US and around the country. It's what we're seeing others doing. And I'm really looking forward to seeing some of CPS, in a way that it has been shown to be safe and has not been shown to drive infections in the community, be able to have some in-person education, where that is possible, where people choose that, just as we've seen good success with in-person education in our parochial and private schools throughout the fall.
Yeah, I was going to say, we have a lot of great evidence that in-person learning is working well in other school systems in the city, and so we're happy to be offering families this choice.
Yeah, and school's not going to look like it did before COVID, right? It's the masks and the distancing and the smaller numbers of children and the contact tracing and the cohorting, and we know that school is likely to be disrupted when either educators or staff or students, if they get infected with COVID outside the school setting and they come in, there are times, and we've been doing this throughout the whole fall, where a whole classroom may need to move to remote learning, or if you were to see a lot of cases, even an individual school, you may need to make that decision. But by and large, we really have not seen outbreaks associated with schools. And like so many other things for COVID, where you are putting it front and center and being really serious about it and following all of the guidelines, we've broadly seen it be in good control, and especially kids, especially the youngest kids, that just are seem less likely to spread it, et cetera. I'm looking forward to hopefully being able to move ahead with that in January.
Yeah, I think people probably noticed that the 0 to 17 group is at the bottom consistently.
Yeah.
So we're excited, and again, we want people to get their questions answered. Please reach out to your principal if you need to do that, or call the CPS helpline if you have questions about it, 773-553-KIDS. So, all right, next question from Jennifer Ross. Once my elderly parents are able to get the vaccine, can I visit them?
All right. So I think we're going to be answering a lot of questions like this probably moving forward. So this is a little bit down the line, as you know, and there will be quite a bit more detail coming out from the CDC about the exact timing related to this. My guess will be that someone will need to, like your elderly parents, would need to get 2 doses of vaccine, first and foremost. Both of these early vaccines and most of the vaccines in phase 3 trials are a 2-dose vaccine series where you get the first dose, then you get the second one, either 21 or 28 days later. And then likely, based on what we know from other vaccines, like for the flu vaccine, we don't consider protection until really 2 weeks even after that second dose. So there will be some specific timing around that. But basically, we will anticipate that people have a very good amount of protection after they have been vaccinated. I think particularly early on, where there may still be a lot of COVID and we're a long way from herd immunity, we likely will recommend that people continue to do the masking and the social distancing. Even a vaccine that's fantastic, like these look to be, 95% effective, it does mean that 5% of people are still able to, in the trial, did get COVID, even though it was a milder case of COVID. We didn't see people getting hospitalized, et cetera. It's an extremely protective vaccine. It's not 100%. So the short answer is that yes, as we have more vaccine available, there will be more opportunity to visit. And I think especially for our people over 65 and with the underlying conditions, this is going to be the way that we are much more safely going to be able to, encourage people to move back to regular lives. But it's going to be a combination of sort of getting that vaccine. It's going to be even better when both of you have had that vaccine, right? And that may happen at different points. And we are still going to recommend that at least sort of for, some months as we are rolling out vaccine, that you continue to do some of the masking and social distancing. But yes, at the most basic level, the reason we're excited about vaccine is it will allow the gradual return of exactly these kinds of activities.
Right, okay. So our own personal mitigation strategies are on that dial.
Yeah, they are.
Rolling off. It's not a light switch.
It's not going to be a light switch. And we're still learning about, for example, when somebody's vaccinated, we know that it seems to be, highly protective, at least the preliminary data suggests highly protective. We're still learning, is there some possibility for still spread? We're learning a lot still. And although the data looks better than I think anybody even anticipated for some of this first safety and efficacy data, we will still continue to be learning about these vaccines, as they're rolled out, really be following, understanding how long protection lasts, understanding the details of, potential side effects. We've not seen severe side effects, of course, or this won't be approved by the FDA, but, we've seen reports that people are getting a sore arm, are getting even some flu-like symptoms you can get for, a day or so after getting the vaccine. That's not the flu, that's not COVID, that's your immune response, sort of your immune system kicking in and sort of learning this is COVID and how to respond so that you don't get sick later. We will have much more to share about this once there is trial data that is actually available, which will be after December 10th, and then lots of follow-up after that. But yeah, this is the promise of vaccine coming out of COVID.
Okay, next question from Joanne Duraya from Facebook. Should dentists and hygienists get the vaccine first?
Yep, so dentists and hygienists will be in that sort of first priority group. Maybe we'll talk a little bit about this if people, I know people sometimes don't watch every time. So we are required at the city to follow the high level prioritization that is put out by the CDC through something called the Advisory Committee on Immunization Practices. And every time, when they meet, and this is the same process we use for every vaccine, not just COVID vaccines.
Not special.
It's not special. It's the same thing. Like if you, go and get a shot or your child gets a shot, the piece of paper you get with the information about it, that is standard all over the country. That is from the CDC and ACIP, and they make the recommendations about who gets vaccine and when. And as more vaccines come out, they'll probably put additional information related to that vaccine. But at the most basic level, they just voted this week officially that in the top tier, sort of our first priority for vaccinating in this country, are healthcare workers and then people in long-term care facilities, meaning both residents and then staff who would also be healthcare workers. And so here in Chicago, we will be starting with hospitals. We are planning to push vaccine to all approximately 35 of our hospitals really right from the beginning, regardless of whether hospitals have that ultra cold storage capacity, which the likely first vaccine Pfizer has. We're doing a lot of work at the health department logistically to support that, but we felt like it was important that safety net hospitals, smaller hospitals, hospitals all over the city would have access to vaccine, at approximately the same time. And then we'll be following that up very shortly with ensuring that really all of our long-term care facilities, the skilled nursing facilities, assisted living, will also all be getting vaccines sort of through strike teams being done with pharmacies really also at the same time. And we're literally talking within the first few weeks of vaccine here in Chicago. We will then, as more vaccine becomes available, because we're not going to have enough vaccine available to, certainly to vaccinate everybody who works in hospitals that first week or two, or probably even over the first month. We're going to continue to add groups. And so just in the first, few weeks to month here, we will start offering vaccination to other healthcare workers. There are healthcare workers who work in hospitals who may not be employees of hospitals, but dentists, for example, are definitely on our list as healthcare workers who have, quite quite a bit of potential to potentially be exposed to COVID, right? You are very, the data has been very good, that we've not seen a lot of spread in this setting, to be clear. A lot of personal protective equipment is being worn in dentist's office. I don't want people to feel like they can't go to the dentist, but nevertheless, you are literally working in people's mouths. They obviously can't wear masks. So they're in a group that will be in that sort of, as we'll get going with hospitals, we'll get going with long-term care, and then there will be work with groups like dentists, with groups like morticians, with groups like other outpatient-based providers who are having higher risk for COVID, and then we'll sort of go from there. Those are all going to be sort of appointment-based. We'll be working with the dental associations, et cetera, to figure out the timing of that and what that looks like. But the city of Chicago will be likely sponsoring those and sort of having some mass vaccination sites for that. So the whole first phase of this is about healthcare workers and about long-term care facilities. And we'll be growing that really week after week after week. I think our plans are very good. And yeah, they will absolutely be among that sort of first tier group. We don't know for sure what the next tier is going to be. The ACIP through CDC will make that recommendation in time. We expect, though, that it will include essential workers, people who are over 65, and people who have adults who have underlying conditions. Not kids yet, because the trials are not done in kids. That'll be probably later in the summer. But that next group, we don't know for sure. Will CDC say essential workers sort of first, and then people with underlying conditions? My guess is they may come at approximately the same time. That's a few months down the road, though. So I don't want people thinking that that's starting in December or January. That will be as more vaccine rolls out, we start getting more and more of the healthcare piece done. Then we'll start moving into essential workers, people who are older, and people with underlying conditions. And there will be much more about that to come. And we'll be pushing vaccine to healthcare providers, probably to some of the larger employers where we think about essential workers. It's going to be a big effort. You likely will be able to get your vaccine through your regular provider. That's our goal. But it just depends on how quickly we're able to get vaccine and then distribute it.
Yeah. Just a finer point on this word recommendation, because that suggests that it's a recommendation, but you can do what you want to do.
Yeah.
It's not quite a recommendation, right?
Yeah.
It's guidance that you have to follow.
It is guidance that you have to follow, yeah. Specifically how it works is anybody who wants to receive this free, and it is free, this is free vaccine coming through the federal government. If you want to receive and when I say receive, I mean like the health department or the provider, and then administer the vaccine. You sign actually an agreement. Like the city of Chicago has signed an agreement that we will follow all of the ACIP, which is the CDC's recommendations, guidelines, et cetera. And that's a requirement actually for any vaccine. It protects us from liability. There's a number of things that come along with that, but we have to follow that. The good news is, though, is that we have some ability. The high level. The high-level recommendations, and they're called recommendations, but we have to follow them, are set, and then we implement them at the local level. So healthcare worker, that is a very large category. Yeah. We have the ability to say, you know what, we're going to go to all of our hospitals at the same time. We're not going to start with the big ones. We're not going to start with here. We're going to, even though it's more work, that's going to be how we do that. We're going to try to go to all of our long-term care facilities at once. We're going to do some prioritization within the healthcare workers about who is at highest risk for COVID and go from there. We have the decision around, how we get that done, who does the vaccinating, where we stand up sort of some of these points of dispensing, these mass points of dispensing. But at the highest level, we don't get to decide, you know what, we don't want to do health workers. We'd rather start with people over 65. That's not how it works.
Yeah. Okay. William Randall from Facebook. Can you carry the virus and infect others after you have had the vaccine?
So again, we are still very much learning about this vaccine, and we haven't seen the official data yet. But the idea is that if somebody has been 95, if this vaccine turns out to be 95% effective, you basically got a 95% chance of being protected from COVID. And we are assuming that a 95% protection from COVID also means that you are not able to transmit COVID. To be perfectly honest with you, those studies are not yet done yet. So we don't know for sure that even though the vaccine, the data has suggested that it is very personally protective, we still don't 100% know that it will have the expected effect of, of protecting you from spreading to others. Most of the people, the specialists who I talk to think it's very likely to have that, but we don't have the official trial data. That's part of why, especially early on, before we're anywhere near herd immunity, even as people get vaccinated, we're going to be asking you to still be doing the masking and the social distancing. This is about getting a population level vaccination done. And as we get more and more of the population vaccinated, the risk continues to go down, and our ability to really open things within society goes up. But at an individual level, I cannot 100% tell you that you first would be 100. There's no such thing as 100% protective vaccine. 90-95 is fantastic, and we're still learning about that potential risk for spread.
You've said herd immunity a couple of times. What does that mean in Chicago?
Yeah, so the idea of herd immunity, and thanks for asking that, because I know it's a word that gets thrown around a lot. The idea of herd immunity is that literally the herd, meaning the population, has enough protection against the disease that even if we have individual cases of that disease, we don't see major outbreaks. And so for the case of, measles is a good example of this. We certainly will see occasional cases of measles from time to time in a traveler who comes in and was unvaccinated, et cetera. We do not see big outbreaks from measles because 90% plus, 95% I think even plus, of our population is vaccinated against measles. That's a really good vaccine. And so we only really have to worry when we have a measles case about people under 1 who are too young to get vaccinated, or people who for any reason did not be vaccinated. But we do not worry about measles sort of threatening large swaths of the population, or that we would need to change our behaviors. For COVID, it's really about getting to a point where we should not assume that we are going to eradicate COVID based on everything we know now. It's possible we come up with a drug or something that turns out to completely be able to get rid of it. But I think it's more likely we will live with sort of a low level of COVID within our society. That's only a problem if it is able to infect the numbers of people with serious illness that we see now, that you have to actually make these major disruptions to society to control the disease. We have to go under these, stay at home and closing places of business. We don't want to have to do that. We have to do that because we don't have anything like herd immunity. So there's a lot of different numbers being thrown around. We don't know for sure. Some of it depends how well the vaccine works in real life. A 90-95% effective vaccine is great because you don't have to vaccinate as much of the population to get to a point where you're actually seeing more of that herd immunity. You have a vaccine that's only 50% effective. You got to vaccinate twice as many people basically to get to to that level. So we think about needing to be at a point where probably 70 to 80% of the population is vaccinated, approximately, is kind of the working number that we're aiming toward. But the sooner we're able to get more people vaccinated, the sooner we're able to break all of these individual chains of transmission, we'll see those numbers come down. And so as those numbers come down, those are the decisions, those are the numbers, as we use every week to make the decision of, can we turn the dial down? Can we open some things up? So it's not like we'll be waiting for this magical 70% vaccinated to say, yay, we can open. We will continue to open as our outbreak is in good control, and vaccine will increasingly be a part of that outbreak being in good control.
Right, got it. All right. So we'll see the impact of our vaccine efforts on the numbers that we look at on a daily basis.
Yeah, I mean, think about nursing homes, right? Like our long-term care facilities, we've had 1,000 deaths or something associated with long-term care facilities just in Chicago. We've had like 5,000 cases, plus. We've had so many cases in staff and residents. The thought of having effectively herd immunity within these super high-risk settings That's huge, right? That's huge in terms of our numbers. It's huge in terms of, the health department puts a lot of resources every single week into all of these facilities to try to control outbreaks. Like, as some of these higher risk settings are able to benefit from vaccine, it is going to start to show real impacts in our numbers. Some of the reasons those 80 plus are so high is because, unfortunately, some of the congregate living settings have, we've learned they're quite risky for COVID. So we will start to absolutely see the impact of vaccination, and as more and more people get vaccinated, that will become a sort of additive multiplier type effect.
Got it. Something to look forward to.
Yep.
Sue Coulson from Facebook. And what happens when COVID mutates as an RNA virus does? That's why we never got a vaccine for AIDS. So
somebody knows what they're talking about. Yeah.
Someone who knows how to
very
get
good.
the doctor going.
Very good. Very good. So, okay, couple things on this. So, COVID is an RNA virus, as is HIV. So you're right that RNA viruses have more potential for mutating than DNA viruses or other viruses. But the good news is that at least so far in COVID, we have not seen mutation rates anywhere near like what we saw in HIV, and nothing like what we see in flu. If we think about flu, the reason we have to make a new vaccine every year is there are so many different strains of flu, and there is so much mutation that happens every single year that we literally have to make a new vaccine every year based on the strains that look like they're the most common. The good thing about COVID is, although we've seen some mutations, they've been really small. And that's because there's been no evolutionary pressure for this vaccine, for this virus to need to evolve, right? You think about HIV.
It's been very successful.
It's been very successful. This has been like an extraordinarily successful virus. We have very few drugs that we've been able to use to fight against COVID. We've not had a vaccine. There's not been a lot of evolutionary pressure at all to evolve. One of the things we saw with HIV and AIDS is that there is very quick mutation, but some of this is that as we were able to develop drugs, and we now have fantastic drugs for HIV,
yes,
each of those gave the virus a chance to sort of mutate. And so we saw a lot of mutation, and it's been one of the reasons why a vaccine has been so elusive for HIV. But COVID doesn't look like that. COVID, at least to date right now, all of the vaccines, or at least the ones that are in late stage trials, they all focus on this spike protein. And so the nice thing is you don't have to you don't really care about what's going on in the rest of the COVID molecule. You just really care about this spike. And so as long as we don't see a lot of mutation in that spike piece, we don't care so much about what happens in the rest of it. And again, we haven't even had COVID on this planet for a year, so we don't know how long longevity may last. But when you talk to the experts, there is a thought that this probably will be at least a multi-year lasting, assuming we don't see major changes in terms of the mutation. And this is, the fact that this mRNA vaccine is, again, just focused on this little piece. That's another reason to think that the vaccine is likely to remain effective, even if you were to see some mutations in COVID itself, unless the spike itself were to change a lot and it really wasn't even going to look like a crown anymore, you would still be effective and protected against it, even if there was change in other areas. Yeah. So it's another reason why this way of making the vaccine is quite a clever way, I think.
Yeah, it's fascinating. Okay, Hector Lyon from Facebook. What's the difference between natural immunity of COVID and the vaccine? People are getting reinfected within 3 months. Why would the vaccine be any different?
Okay. Yeah, lots of good questions today. All right, so this idea of natural immunity, similar to any disease, is that you can get exposed in nature and recover and have some level of protection against the next time you see that disease. You basically, instead of teaching your immune system to fight off, COVID, for example, through a vaccine, you get the real thing, right, and you build up that immune response. You've learned how to do it, and you have some level of protection when you next encounter it. As you know, there have certainly been actually hundreds of examples now of people getting reinfected with COVID. So we know, although it doesn't seem like it's that common, it is absolutely possible for people to be reinfected even after having been infected the first time. We do know there's some protection, though, for sure. And we think it probably lasts in that 3 month. It could be more range. But the problem is there's a lot of variability when you're sort of trying to go after immunity naturally. It depends how well my immune system does. If I have a very robust immune response, I would probably have more protection. But people who don't get very sick, don't have a lot of symptoms, usually don't mount a very strong immune response. They may have less protection when it comes along. And the problem is a lot of like the other coronaviruses, this natural immunity, like the ones that cause the common cold and stuff, it really lasts like a year maybe. Like it's not thought to be a good long-lasting protection. On the other hand, the vaccine has really been, again, kind of engineered and developed to be focused on things like this spike protein that there is thought to be less variability in terms of how I respond to it, and more literally you're just training the immune system to recognize this as an invader and then be able to respond. And so it doesn't take into account like how good is my immune system, not really anyway, not as much, or how much virus was I exposed to. It's a more standard amount of a dose of a vaccine, and then presumably a more predictable immune response. And we'll be following certainly people even after the vaccine is approved. The trials continue, and we'll be following people who are getting vaccine in the real world to understand things like how long this may last.
Yeah, it's here with us, and it'll be constantly, we'll be learning more as we go.
Every month we learn more.
I'm going to squeeze in this last question. Ilya Valkovsky from Facebook. What would be a protocol for college kids coming home for winter vacation?
Okay, so it really depends a little bit where the college kids are coming from. As a reminder, if you look at the travel advisory for Chicago, there are only 3 states at this point where we don't have some level of recommendation around people who are traveling. So if you've got a college kid coming from Maine, Vermont, or Hawaii, they can, those are the only 3 states at this point that have COVID in reasonable control, honestly, less than 15 cases per 100,000. There's not a requirement there around what they need to do. But for really everybody else, which is most college kids, the recommendation is, first of all, just to recognize that they have been likely in higher risk settings, right? We know that colleges have been higher risk settings. Most colleges do have testing protocols in place at this point. And so people, I would hope that your college student is getting tested prior to coming to Chicago. All of our states in orange, right? Like there's this requirement that people should be tested within 3 days of coming home to Chicago. And I hope that you have your college kid get tested sort of before they travel back here. But remember, a negative test does not rule out the possibility that they have COVID. We know that it can take time for COVID to actually take hold in your body. If you get tested the day after you were exposed to COVID or 2 days after you can be infected, that test will be negative. So and this is where some of the guidance is starting to evolve a little bit, but really for at least 10 days after they're home, you got to be really careful with the college students. Like they can be home, but they should not be, having close contact with people who have underlying conditions. Should be wearing masks ideally, trying to keep distance. Just be careful. Not the time. Normally, kids come home for winter break, and it's like get together with the friends and go out for the parties. We really don't want to see. One of the concerns around Thanksgiving and winter break broadly has just been this possibility for really spread of COVID across the U.S. Yes. So I think be especially careful. For especially the first 10 days after kids are back, anybody with symptoms needs to get tested, and just use some common sense.
Yep. Sounds like they shouldn't be moving around a lot when they get here.
It's hard because they all want to see their friends and do all of that, but it's there's some risk there, particularly in that first week to 10 days after they're back.
All right. I think we have probably 2 minutes left for some good news, Doctor.
All right. Well, I think one good news is 1 week from today is the first FDA evaluation of a vaccine in the U.S. So the Pfizer vaccine, 1 week from today, will be considered by the FDA. And I think it's likely, we'll certainly see what the data looks like, that will get the emergency use authorization, and then the CDC will have to weigh in. But vaccine really is coming, and that is good news. Although it's got all the logistics and it's going to be a big conversation, I am really really excited about, this next phase, because this does mean getting past COVID, even though it's going to take months.
It's the light at the end of the tunnel.
It is. So that's my biggest good news. I think the other, just a reminder, #TakeoutChicago. You've got another 12 days through December 15th to have gotten takeout from 10 different restaurants and bars going back to mid-November. You just put in, it's kind of on the honor system, chicago.gov/takeout, your information, where you got the takeout from, and then you get entered into some drawings for really cool things, like behind-the-scenes tours at Soldier Field and the Art Institute, and a lot of interesting Chicago experiences, which will come a little bit later down the line. But just a reminder, this is just, it's a hard time for everybody, but especially our smaller businesses, restaurants, bars, etc. And if you are able to support them economically, I would encourage you to do so. I have done this challenge, so I already have my 10. I don't think I'll be allowed to win the award, but that's okay. I think I am. I think I am. And then maybe just one other good news is that the Department of Business Affairs and Consumer Protection and the mayor have been introducing a number of additional sort of ordinances and relief things for businesses. So you can go to the Business Affairs and Consumer Protection site to learn more about that, but we've been really looking to reduce permit fees, extend business license renewals. We've extended the outdoor dining program. There's a cap on the third-party delivery service. So if you order, from one of these delivery services, they are only allowed to charge sort of a certain amount for a limited period here to businesses. So there's been some good work there, really trying to think about keeping our businesses supported, and but the other way you keep the businesses supported is helping get our COVID numbers down. That at the end of the day is how we're able to get things reopened.
Yeah, if we stay on this trajectory.
If we stay on this trajectory, I'm feeling good about this trajectory. I want to see it continue. We got to get it down. Even in the winter, I think we can do it.
Yeah, we can do it.
We can do it.
It is possible. It's not.
It is.
But it's not.
It is.
And the other way we can support our restaurants and businesses, especially as we approach the holidays, is to shop local online. So we celebrated Black Friday with the Black Shop Friday, just pointing people to local businesses. And let's just keep that shopping local online going too.
Yep, absolutely. So thanks for everything you're doing. You are part of the progress that we are seeing here. It is not the time to let up on this. I don't want people saying, oh, that looks pretty good, right? Now I don't have to worry. Absolutely not. We are not even halfway down where we need to get. But if we hang in there and keep doing these things that work, I'm feeling better about where we are. Just a little worried about how holidays are going to play into this. And I can't control, we can't control anything really, but the things that happen nationally, in particular, are just, they continue to have impacts on us here.
Yeah, so that part to be continued.
To be continued.
But let's continue to think twice and do all the things that we know really matter in terms of protecting ourselves, protecting our families, and protecting our communities.
Keep sending in your questions. If we didn't get to them, we'll either do short versions or try to answer them on Tuesday. In the meantime, be safe, Chicago.